Welcome to the fascinating world of endocrinology. Today, we are going to explore endocrine secretion disorders, specifically focusing on hypersecretion and hyposecretion. Think of your body as a highly advanced, fully automated factory that needs to run perfectly 24/7. We will learn what happens when the communication in this factory breaks down and how doctors use simple mathematics to save lives. Let us dive in. Now that we have introduced our topic, let us build an intuitive understanding of how this system works. Imagine your body is a factory. In this factory, hormones are the chemical text messages that tell the machines exactly how fast or slow to work. If the factory manager sends too many messages, the machines go into overdrive, overheat, and eventually break down. Conversely, if the manager falls asleep and stops sending messages, the machines halt and production completely stops. This delicate balance of communication is exactly how your endocrine system works to keep you healthy, energized, and stable. Building on our factory analogy, let us look at the formal medical definitions. An endocrine secretion disorder occurs when a gland produces an abnormal amount of a specific hormone, severely disrupting the body's internal balance, known as homeostasis. We classify these into two main categories. Hypersecretion refers to the excessive production and release of a hormone, often caused by glandular tumors or autoimmune conditions that constantly stimulate the gland without pausing. On the other hand, hyposecretion is the insufficient production of a hormone, which can result from physical glandular destruction, genetic defects, or a lack of dietary precursors like iodine. Understanding these basic definitions leads us to how doctors classify and treat these conditions in the real world. These disorders can be classified as primary if the defect is located in the target gland itself, or secondary if the defect lies in the pituitary gland or hypothalamus that controls it. This distinction is absolutely critical because hormones regulate virtually every physiological process, from your resting heart rate to your bone density. Millions suffer from diseases like diabetes mellitus, hypothyroidism, and Cushing syndrome. By pinpointing exactly which hormone is malfunctioning, endocrinologists can prescribe precise, life-saving treatments to give patients their normal lives back. To truly understand how these disorders affect the body, we must look at the mathematics behind hormone concentration. Do not worry if math seems intimidating. We will walk through this together. The endocrine system operates much like a bathtub with a running faucet and an open drain. The steady-state plasma concentration, represented by C, is a delicate balance. It equals the rate of hormone secretion, RS, divided by the metabolic clearance rate, CL. In plain English, the amount of hormone in your blood goes up if the gland secretes more, and it goes down if your liver or kidneys clear it out faster. Before we look at a disorder, let us see this formula in action with a healthy patient. We are given a normal thyroid hormone secretion rate of 80 micrograms per day and a clearance rate of 10 liters per day. We want to find the steady-state concentration. We choose our formula, C equals R sub S divided by CL, because it perfectly models this balance. We substitute 80 for the secretion rate and 10 for the clearance rate. Dividing these gives us a final concentration of 8 micrograms per liter. This baseline level shows the body is perfectly balancing hormone production and waste removal. Now that we know the healthy baseline, let us calculate what happens when a patient develops a hypersecreting thyroid tumor. This patient has a massive secretion rate of 240 micrograms per day, but the exact same clearance rate of 10 liters per day. We use the same formula to find the new concentration. Dividing 240 by 10 yields a drastically higher concentration of 24 micrograms per liter. Because the clearance rate did not change to compensate, the blood concentration inevitably rises. The circulating hormone levels have exactly tripled, physically translating to a dangerously accelerated heart rate and severe weight loss. Having seen the dangers of hypersecretion, let us explore the opposite problem, hyposecretion, and the formula used to treat it. When a gland fails completely, doctors must artificially replace the hormone. The required medication infusion rate, RMED, is equal to the target healthy concentration, C, multiplied by the patient's clearance rate, CL. Conceptually, this tells us exactly how much artificial hormone must enter the bloodstream to match what the body is clearing out. If the target concentration increases, or if the body clears the hormone faster, the required medication rate must physically increase to maintain that delicate balance. Let us apply this treatment formula to a real clinical scenario. A patient with Addison's disease produces almost no cortisol. The target healthy concentration is 15 micrograms per deciliter, and their clearance rate is 2 deciliters per hour. We need to find the continuous medication infusion rate. We use our replacement formula because the patient's natural secretion is 0. We substitute 15 for the concentration and 2 for the clearance rate. Multiplying these gives us exactly 30 micrograms per hour. Physically, the doctor must program the intravenous pump to deliver this precise amount every hour to keep the patient alive and stable. Now that we have successfully calculated the life-saving medication rate, let us understand exactly where this treatment formula comes from. We are setting out to prove how the biological goal translates into a clinical treatment plan. We start with our original steady-state equation, where concentration equals secretion rate divided by clearance rate. In a case of severe hyposecretion, the natural secretion rate is 0. Therefore, the medication infusion rate must entirely replace the natural secretion rate. We substitute the medication rate in place of the natural secretion rate in our equation. This sets the stage for our algebraic derivation. Continuing from our previous step, we now isolate the required rate of input. To solve for the unknown medication rate, we multiply both sides of the equation by the clearance rate. This algebraic step cancels out the clearance rate on the right side, leaving the medication rate completely isolated. We arrive at our final result. The medication rate equals the target concentration multiplied by the clearance rate. This simple yet profound mathematical rearrangement bridges the gap between a biological concept and a practical clinical tool, beautifully illustrating how mathematical modeling directly saves lives in the field of endocrinology. To visually reinforce what we have just calculated and proven, let us look at this hormone concentration graph. On the vertical axis, we have the blood hormone concentration, and on the horizontal axis, we have time in days. Notice the green line in the middle. This represents normal homeostasis, the healthy baseline we calculated earlier. Above it, the red line shows hypersecretion, such as from a tumor, where concentration spikes dangerously high. Below the green line, the blue line represents hyposecretion, like gland failure, where levels fall below the threshold needed for normal function. This diagram perfectly summarizes the mathematical shifts we explored. We have covered a lot of ground today, so let us summarize the most important ideas. First, Endocrine secretion disorders fundamentally disrupt the body's delicate chemical balance through either the overproduction or underproduction of vital hormones. Second, by understanding the mathematical relationship between secretion rates and clearance rates, we can accurately model and diagnose these conditions. Finally, this mathematical knowledge allows medical professionals to calculate the precise treatments needed, whether that is suppressing a hyperactive gland or providing hormone replacement therapy. You now have a solid understanding of the mechanics behind endocrine disorders. Great job!